Hello, my name is Marie Namey, and I'm an advanced practice nurse at the Mellon Center for Multiple Sclerosis Treatment and Research at the Cleveland Clinic Foundation. I've been working at the MS Center now for almost 30 years and have really developed an interest in taking care of patients who have multiple sclerosis. And today there's a couple topics that I'd like to discuss. One topic that I'd like to discuss, which many patients need an answer to, is when to call a primary care doctor and when to call their MS specialist. And so Linda's with me today, and we're going to discuss this topic so that maybe you and others can have a better understanding of when it might be more appropriate to call your primary care doctor or when you might want to call your MS specialist. As you know, MS can affect many, many different symptoms. It affects the brain and the spinal cord, and that can create a variety of symptoms. But some symptoms can be caused by other things, other conditions. And so hopefully in reviewing some of what I'll say, it'll help you understand better and maybe make the right call. So because MS affects the brain and spinal cord, people can have trouble with vision, with thinking and memory and judgment, with how their face feels, with their hearing, with speech and swallowing. A part of the brain can make you feel dizzy when there's nothing to feel dizzy about. Another part of the brain can cause you to have incoordination or imbalance. MS in the spinal cord, in the neck, or in the thoracic or the lower regions can cause you to have weakness or odd sensation anywhere in your arms or legs. It can also cause you to just not feel right, maybe have some fatigue because the nerve impulses are not moving right. Does that make sense of how MS might work? So MS does not affect your major organs. Heart and lung are not affected, and so it's important to have a primary care doctor to manage some of these other concerns that can occur. You know, at age 20, at age 30, at age 40, 50 and beyond, we need to have some health screening checked out by our primary care doctor. And those are tests that we don't do. We're more focused on the nervous system and what happens with MS. And so because MS doesn't affect major organs, I think it's a relief to know that it won't affect your lungs and it doesn't affect your heart. But if you're having trouble breathing, if you have a cough, if those kinds of things happen, then it's probably more important that you call your primary care doctor than your MS specialist. This is a time of colds and flus, and so it's important to have a primary care doctor that can see you soon and prescribe something if it's indicated for you. If you have an infection that needs an antibiotic, they would be the ones to do that for you. Certainly if you are bleeding, if there's any worry that your heart's racing too fast, or if you're uncomfortable in any way or worried about your health, 911 is the number to call. You know, people can come and they can make an assessment and then take you to an emergency room or to the hospital locally, or just take care of you as it is. Does that make sense?
Yes, it does.
Do you have any questions about what I've talked about so far?
When is it the best time to call your family doctor, just for a cold or flu symptoms?
Again, when you're concerned about how you're feeling and you don't really recognize things as an MS symptom, that might be the best time then to call your family doctor. If you have a thyroid condition, if your blood tests come back and you're anemic, or we see other abnormalities, that's taken care of by a family doctor. If you have high blood pressure, that's taken care of by a family doctor. If you have diabetes, if you have any other diseases. Unfortunately, people who get MS can also be diagnosed with other disorders, and that needs to be managed by the appropriate provider. Sometimes it's hard to decide, who do I call? My MS doctor, and maybe you see us more than you see some of your other providers, and you feel more comfortable, but you have to think about who's the one who's taking care of this particular problem. So thank you for listening to this dialogue about when to call your MS specialist and when to call your primary care doctor. MS isn't always the only problem people with MS have to manage. Don't assume everything is MS related. So if needed, have a conversation with your primary care doctor about when to call, and we will certainly guide you too. If you'd like more information about this topic, please contact us at the website listed below.